Well, let's just get started. We have people coming in and really fast, but we've got a strong program tonight. So let's get going. Welcome, everyone. My name is Brittany Shanahan, and I am the organizer for Public Citizens Medicare for All campaign. I am thrilled to welcome you to tonight's Florida Medicare for All Town Hall, co-led by the Florida Medicare for All Organizing Committee. I also want to thank all of the organizations that co-sponsored this event tonight. What we are doing with this town hall is we are trying to create a platform that is a platform for a stronger movement for Medicare for All in Florida, to forge relationships between groups that may not have even met before and to really build for that future. So I just wanted to share really quickly this image of to show how many co-sponsors we got for this event. I feel pretty confident in saying that this is the largest group of co-sponsors we've ever seen for a Medicare for All event in any state that we've worked with, and it really testifies to the enthusiasm with which the people of Florida see Medicare for All as an essential and transformative solution to our healthcare crisis. So I'm going to try and read them out really fast like a Tom Lehrer song. I was debating on whether or not to do this, but I want to do it right now because it really shows how much momentum is behind this movement. All right, so here we go. Physicians for a National Health Program, PNHP National, PNHP Florida, Justice for All Network, Central Florida AFL-CIO. You heard that right, AFL-CIO. Florida at AFL-CIO, that was a big win. Progressive Democrats of America National, PDA Central Florida, P40A Central Florida, Florida's 6th District Healthcare Action Group, One Payer State, Seminole County Progressive Forum, Standing Heroes for Average Workers, Shaw, Healthcare Now, Hope Community Center, National Nurses United, Florida National Organization for Women, Our Revolution, Communication Workers of America, Local 3108, Center for Popular Democracy, Forward for Progress, Committee of Interns and Residents, SEIU, AIDS Healthcare Foundation, Women's March Florida, Florida Rising, Orange County Branch, NAACP, Labor Campaign for Single Payer, Labor Community Alliance of South Florida, Florida Poor People's Campaign, CWA Board of Presidents, People's Progressive Caucus of Miami-Dade, Democratic Progressive Caucus Florida, DFA Palm Beach County, Community Healing Project, Students for a National Health Program, FSU Chapter, Alachua County Labor Coalition, and Central Florida Jobs with Justice. All right, let me stop sharing. All right, so Florida entered 2020 as the state with the 4th highest uninsured rate in the US. Then the pandemic hit, and it really has laid bare the dangers of our for-profit healthcare system. But Florida activists are resolved to work to transform our healthcare system. And that is what tonight's town hall is all about. To learn from experts about Medicare for All, to find out how to get involved in our communities, and to take action. We are honored that we will have with us tonight U.S. Representative Frederica Wilson of Florida's 24th Congressional District. Representative Wilson is a co-sponsor of H.R. 1976, the Medicare for All Act in the House. Experts will discuss the benefits of Medicare for All that Medicare for All will bring once implemented from a public health, economic, and labor perspective. So in tonight's webinar format, unfortunately, only panelists can speak, but we do want you to interact with us. So please put your name, pronouns, and where you are from in the chat, as well as what motivates you to support Medicare for All. And now, so that I can take a bit of a breath, we are honored to hear from Representative Frederica Wilson of Florida's 24th Congressional District. Elected in 2010, she has served as an unrelenting advocate for racial and economic justice. From her former roles as an elementary school principal, a school board member, and as a state legislator, Representative Wilson can really lay out for us the transformative power of Medicare for All, speak about why she decided to co-sponsor H.R. 1976, and make a strong case for why the leadership of Florida activists in this fight is so crucial. Welcome, Congresswoman Wilson.
So much, everyone. Good evening. Hello, everybody. I'm Congresswoman Frederica Wilson from the 24th District of Congress. And I want to know that it is such an honor to be here to participate in this statewide Medicare for All town hall. I'm proud to be here as we discuss the pathway to Medicare for All. So I want to thank you, Melinda St. Louis and Brittany Shanahan of Public Citizens Medicare for All campaign for welcoming me and for your continued efforts to fight for Medicare for All. This is going to take all of us nationally trying to do this. I want to thank all the organizations and advocates on the call tonight who are working with elected officials to pass local resolutions in support of Medicare for All. And today's panelists, thank you for lending your expertise to such a worthy, amazing cause. For over 2 years now, the COVID-19 pandemic has overwhelmingly impacted communities nationwide. And due to more than 3.7 million positive COVID-19 cases and more than 62,000 COVID-related deaths, Florida has been no exception. And we're really not out of the woods yet. If the COVID-19 pandemic revealed anything to us, it is that health insurance is necessary and should be accessible for all people. Healthcare truly is a human right. Unfortunately, tens of millions of Americans are still uninsured, and so many are underinsured. And the high cost of healthcare means that too many families are experiencing financial anxiety over their medical bills or have been forced to declare bankruptcy. How about that? Alarmingly, high costs do not translate to better health outcomes, including in areas like life expectancy and infant mortality. And we know that people of color and other underserved communities have been faced with disparities in accessing high quality care. It's clear that for most Americans, the status quo is actually failing. That's why in Congress, I'm proud to be an original co-sponsor of the Medicare for All Act. Thanks to advocates like you across the country, the Medicare for All Act has now more than 120 co-sponsors, and the list continues to grow. I want to thank my colleague and chair of the Congressional Progressive Caucus, Congresswoman Jalapal, for leading this effort in the House of Representatives. The Medicare for All Act would guarantee health care for every American, period, including access to primary care, vision, dental, prescription drugs, mental health resources, substance abuse support, long-term services and supports, reproductive health care, and more. It would also provide universal coverage of long-term care with no cost sharing for older Americans and individuals with disabilities, and would put in priority order home and community-based care over institutional care. You see what a difference this would make? And because we must do everything we can to bring down exorbitant costs as fast as possible while expanding access to care, I'm also proud to support measures like the Improving Medical Coverage Act, a bill that would lower the current Medicare eligibility age from 65 to 60, and the Elijah E. Cummings Lower Drug Cost Act, named after my late dear friend, that would establish a fair price negotiation program protecting Medicare from excessive price increases and establishing and out-of-pocket maximum for Medicare Part D enrollees. And although the Bipartisan Infrastructure Investment and Jobs Act, of which I was proud to be one of only 5 members authorized to co-sponsor and was signed into law by President Biden, manufacturers of certain single-dose drugs under Part B of the Medicare program are required to provide refunds with respect to discarded amounts of such drugs. However, many of these policies continue to be stalled by Republicans in Congress. That is why it is so important for advocates such as yourselves to push for universal access to health care at all levels of government. While at times it may feel as though we are far from a national policy providing for Medicare for all, I hope that you'll know that we are moving in the right direction. And it is because of your efforts that we will get there together. Thank you so much for inviting me tonight. And thank you, all of you, for your unwavering support of Medicare for all. We will get there. Thank you.
Thank you so much, Representative Wilson, I hope that I can speak for the room in saying that we are extremely grateful for your leadership on this issue and for taking time out of your schedule to open up for us tonight, to inspire us with your words and your great sense of style. So thank you so much for joining us. So next up, I am so excited to introduce Stefan Ramdor of Florida's Medicare for All Organizing Committee. Stefan initiated and pushed for the idea of a Florida Town Hall, and much of what you're seeing tonight is the result of his work over the last few months. So Stefan, welcome.
Thank you, Brittany, and thank you, Congresswoman Wilson. This is fantastic. So my name is Stefan Ramdor. I'm a retail worker living in the Orlando area, and I'm with the Florida Medicare for All Organizing Committee. While this grassroots group has just started last year, we already have been very active. For example, over the course of the last 3 months, activists with the Florida Medicare for All Organizing Committee put on several text banks and phone banks, and among other things, sent out more than 44,000 text messages about Medicare for All to Florida voters. We identified hundreds of Medicare for All supporters, and many of them also signed up petitions where we call on US representatives to co-sponsor HR 1976, the Medicare for All Act of 2021. You will hear more later during this town hall from Brittany about the upcoming activities of the Florida Medicare for All Organizing Committee. But now I am delighted to introduce our next speaker, Leo Alonso. Leo is an emergency medicine physician from Jacksonville. As he is a physician, he's also active with Volunteers in Medicine Jacksonville Clinic, which is primarily serving the region's working uninsured. Leo Alonso is also a founding member of the Florida chapter of Physicians for National Health Program. As a physician every day at work, Leo sees the unnecessary suffering brought onto people by the current inadequate health insurance system, and he sees how Medicare for All fundamentally would change things for the better. In addition, Leo is also a member of the Florida Medicare for All Organizing Committee. So Leo, the floor is yours.
Well, thank you, Stefan. I want to thank Stefan. He's a remarkable person who works avidly to make this all happen. And thank you for having me and all of you for participating. This is an exciting time. I've been practicing for over 28 years in the emergency department, and emergency medicine, unlike other specialties, we're mandated by federal law to see everybody regardless of their ability to pay. And it always fascinated me why certain people would delay their care. Why would they take so long to come to the emergency department? And often it was sad to see them bow their heads down in shame because they would say they didn't have insurance and they waited, and they would come as a total train wreck. I mean, I can bore you with many stories, but a few that come to mind are men who were in cardiac arrest because they had been complaining of indigestion, which we turned out to be unstable angina, chest pain, and they blew it off because they had no insurance, and they come in a full cardiac arrest. Many of them died. Or hypertensives, the silent killer, where you don't feel anything till it's too late, the stroke, the heart attack. I even had diabetic women come in for a simple injection of insulin because on Medicaid, it would cost them so many hundreds of dollars that they couldn't afford. So for me, it's a very real problem, this lack of healthcare. And it's more than a problem. It's almost like a violent act of our country to its people. Think about it, the wealthiest nation on earth, and we're the only ones that don't cover every citizen. Why is that? Well, there's many reasons, but the profit motive is big. And, you know, you could argue that millions of people have died over the decades unnecessarily because of a lack of health care. So I applaud all of you for attending this because it shows you have your heart in the right place. It's also like Representative Wilson said, it's so immoral when you think about it that when people do seek health care, then if they have no insurance or underinsured, then they're bankrupt, right? We not only don't provide the care, but then we wound them with a bankruptcy, which, you know, destroys your personal life and income. I personally I'm an independent contractor, so I pay over $2,000 a month in premium. Isn't that crazy? With a $6,000 deductible, my wife and I. So if you do the math on that, that's about $25,000 a year. How can an average American afford something like that? They can't, right? So they get very bad policies, these so-called bronze plans or whatever, where there's huge copays. So the underinsurance is a big issue. So, you know, I debated about getting wonky and talking about all the nuances of healthcare, but I think almost everybody on this panel knows that it's a train wreck, that we have to reform it, that Medicare works in the elderly, Medicare will work for everyone else. We just need to get away from this fragmented system of, oh, I've got a good health plan in my job and I don't want to give it up. Well, guess what? Millions of people are laid off every year. Look at what the pandemic did, right? It laid off gazillions of people right when they needed healthcare the most. So I think our job is to dispel the myths. There's so many lies. We have the best healthcare system, blah, blah, blah. You know, as a doctor, I live this. It's not true. It's a lie. And we just need to keep advocating. So I applaud all of you and keep fighting and joining. And I encourage you to participate in more of these events. And thank you for letting me participate.
Thank you. Thank you so much, Leo.
My pleasure.
Next, it is my pleasure to welcome Lynn Unruh. As a registered nurse, Lynn is able to provide us some insights into the healthcare system, but tonight, Lynn will give a brief presentation on why Medicare for All will save the nation as a whole money, and while at the same time, will be providing us with better healthcare. Lynn is a health economist at the University of Central Florida. Lynn is also one of the founding members of the Florida chapter of Physicians for National Health Program. Lynn, the floor is yours. Lynn, I think you're still muted.
All unmuted.
Okay. All right. I'm very happy to be here, and I have some slides because it's helpful to be able to show graphically some of these issues that we have with the economics of our healthcare system. And I want to talk tonight about how there's really two myths around why we can't have Medicare for all. There's many myths, but there are two economic myths. One is that it's not economically necessary, and one is that it's not feasible. So those are the two things I want to cover tonight. First, as far as necessity, when we compare the US to other countries in the world, we have the highest expenditures, healthcare expenditures of any country in the world. This chart here shows just 5 countries, and among those countries, the US is the highest, but it's the highest of all countries. And for that high expenditure, which is really outrageous, it's $4 trillion this year in terms of our overall expenditures, which is now close to 20% of the GDP and over $12,000 per person. For that, here's the performance that we have. This is a performance ranking of the Commonwealth Fund, a very reputable organization that does this biannually. And they include a lot of different things in terms of performance. Here's the US way down and the lower performing among 11 countries here. We're the lowest and way far away from the top 3 country average and very far away from the top 10 country average, which is right here. So we don't get value, and that value is an economic term that looks at how much you get in terms of your quality and your quantity in terms of compared to what you pay for it. We don't get much. Out of that too, people have problems paying medical bills, as Dr. Alonso talked about. Even the insured, 14% have difficulty paying their bills. If you're underinsured and uninsured, even a higher percentage have difficulty with that. And when people can't pay their bills, they often go into debt, and we know that 2/3 of the bankruptcies in the US are healthcare related bankruptcies. And it's going to get worse. This is a little bit older projection by the Congressional Budget Office, but I like to use it because the CBO is our own government doing estimates, and they are showing that the uninsured is only going to rise in the future, and this has a lot to do with the loopholes and problems with the Affordable Care Act that have not been solved yet. So with that, it's pretty obvious that yes, we need something different than the system that we have. So let's look at, and we know that that Medicare for All would cover all people and would be an improvement over our existing system, but is it feasible economically? Well, the first thing to look at is that it would be less costly than our current system. First off, when Medicare for All would be a single payer system in which the government is the payer. So there's not multiple billing, not multiple companies, insurance companies. Administrative costs are much lower in single payer types of systems. Currently, our US private insurance has 12% of the costs of insurance are due to administrative costs. US Medicare, which is a government-run system, has 2.2% of its costs attributable to administrative costs. Canada, which is a single-payer system, has 1.6. There's also lower physician administrative costs because physicians don't have to deal with 100 different insurances, and everyone bills differently. Everybody has different rules for what it will cover, etc. Physicians spend an enormous amount of their own costs on running administrative issues, and 4 times as much as Canadian physicians do. Hospitals maybe can be paid on a global basis, depends on how we want to run the Medicare for All, and that would also reduce costs because then hospitals would have a set amount of money to work with, and they would not have to bill separately for any of the cases that come in. And there's some other incentives built into that. We can negotiate prices with pharmaceutical companies and medical device companies and get those prices down that right now we're just not having any control over. And we can also focus on services that, at least in the long run, are very cost effective, and that's prevention, primary care, and dealing with the poverty and inequality in our country, all of which lead to very poor health and higher healthcare costs. So what do we get with Medicare for All? We, first off, would have 12% that would be new expenses that would go into covering all the new people that we're going to bring in. But this is well covered in terms of savings. first, we're going to have 9%, and this is a study that was done by Paulin et al., or the Perry Institute and Amherst. And we'd have 9% that would go to reduction of administrative costs, the health insurance, hospitals and physicians and others. We would be able to get lower pharmaceutical pricing, which would save us 5.9%. We would be able to make all the provider payment rates uniform, pay physicians, hospitals more than Medicaid, around the amount of Medicare, somewhere in that range, but all of it would be even and equal, and that would also bring down some of the costs and result in some cost savings. And then we'd have a reduction of fraud and waste. I really like to have this separated out, but it wasn't in the study. So fraud would be billing that provider that hospitals do, say, for example, to upcode things so that they get paid more money. Waste would be more along the lines of physicians over treating, not having too many examinations, too many tests, too much drugs, pharmaceuticals, etc. And a lot of it because a lot of people have different positions and there's not a lot of coordination of our healthcare. All of this could result in some reduction in some savings, cost savings. So Medicare for all just makes common economic sense. For one, it pays for itself, and in some studies, more than pays for itself. There's actually some extra savings left over. But in a review of studies of the economics of Medicare for all that was done by Kai et al. In 2020, they found that 19 of 22 studies found that the savings funded coverage in the first year, and that all 22 studies found that the savings from Medicare for all would fund coverage in 10 years. A letter went around in 2019 that was signed by 253 economists, which I thought I signed, but I couldn't find my name on it when I was looking through it today. So say 254, but they basically support Medicare for all. And this is a phenomenal thing because economists tend to be conservative. And I recently saw another letter that said that was out that had signatures by 50 economists that said Medicare for all was terrible. So far we have 254 for, around 50 against. But it's an interesting development. And then probably the most important thing is that studies tend to show that given the fact that there's an overall healthcare fundability to it, that the savings would equal or outweigh the costs. What's even more important is that every individual, most people in the US would have a reduction in their current healthcare expenditures. And that's what insurance companies and all of the lobbyists that are against Medicare for all don't want people to really understand, is that our system is now so expensive and Medicare for all would actually reduce most people's healthcare costs. I'm probably running out of time and I can't see because my slides are covering the screen, but this is just a scheme for how it would happen. And there's other ways to do it, but this one, the basic thing is you just use existing funds that are already there at the state and federal level. You replace premiums that employed workers have with progressive taxes, and you would have progressive taxes on all Americans, and you have employer side payroll tax. Through these three ways, we should be able to fund it with and lowering the cost to most people. And just to close, the impediment to fundamental reform in healthcare financing is not economic, but political. So let's deal with the political side of it. And thank you.
Thank you, Lynn. This was fantastic. Thank you so much for really providing us with all of the details about how Medicare for all would save us as a nation money while at the same time providing us with better healthcare. And now it is my absolute pleasure to introduce Rhonda Wallace. Rhonda is a statewide community action team manager with Florida Rising. Florida Rising is an independent organization working to increase the voting political power of marginalized and excluded constituencies, including Black, Brown, and immigrant communities. The issues that Florida Rising works on include healthcare and housing, among others. For example, last Friday, Rhonda put on an eviction protection Zoom call with attorneys, giving a presentation about tenant rights. And every Tuesday, Rhonda brings Florida Rising members together inside of a community action team. But in addition, Rhonda is also a member of the Florida Medicare for All Organizing Committee. So Rhonda, the floor is yours.
Hey, thank you so much. And I'm so proud to be a part of this change. This is something I could tell my kids about, their kids. We are definitely making a difference in people's lives because health is everything. So saying that, again, my name is Rhonda Wallace and I'm the statewide community action team manager with Florida Rising. Florida Rising, like my colleague said, Stefan, is a people power organization building political power in Brown and Black communities. And this is my compelling story. My best friend, Juan Perez, who is also a member of Florida Rising, has fallen ill due to healthcare related issues. And I feel like, you know, they have to be addressed by the state. There are many people literally suffering every single day in healthcare fields and outside those healthcare areas as well. They're just trying to survive and live every single day to make ends meet for themselves and their families. My best friend, Juan Perez, has always been such a really hard worker. He's a very strong Latino man, one of the strongest men I've literally ever met. He always holds down jobs, hoping to secure proper health care so that he may get his life back on track and feel better while he's working every single day to support his family. To say the least, he has undergone severe poor health care. And before this, he's been recently diagnosed at this time with having liver cancer. I know the system has failed him. And that's a big sacrifice. And no family should have to make that sacrifice. No brother, no sister, no aunt, no uncle. Anyone of us, you know, our loved ones can be ravaged by disease and our hearts ravaged along with them in those depths. Right now, he's battling still in the hospital bed right now. And the referrals that he get, they haven't given him any type of healthcare even still to make his life whole, to really treat everything that he's going through. So I know that Medicaid for All will really do that for everybody on this call and outside this call as well. Even though my best friend has been diagnosed with liver cancer and he can't get out of bed, I'm getting out of bed for him right now. Even though he's sick and he's tired, I'm gonna advocate for him right now. I'm standing up for him at this moment for change, you know, and not just for the members of Florida Rising like Juan Perez, who has not benefited from proper health care through Florida, but you know, the other people who are just surviving as well, each and every day. We want to know, if you would like to know more about how you can be a part of this change with Medicare for All, you know, this is the beginning, being on this call, taking those first steps, or want to know about Florida Rising as well. But again, I want to thank everyone for their time and just their dedication to this movement and for welcoming me in this space as well. Thank you, Stefan, and everyone that has heard my story.
Thank you so much, Rhonda, for joining us and sharing your story. I think so many of us, like, we have someone close to us that this has happened to, and when you hear someone else say a similar story, it makes us feel so much less alone, and that's so important in this. So anyway, hi again. I am actually coming back to everyone in a different capacity to introduce you all to the Medicare for All Resolutions campaign and explain how municipal resolutions can make a major impact in movement building for Medicare for All in Florida. As of now, in the last 3 years, we have passed 92 city council and county board resolutions around the country in support of Medicare for All, including 3 in Florida, St. Petersburg, Tampa, and very recently, Key West. So Let me share my screen here. Oh, I exited out of the right one. Okay. Let's go again. Show all windows. That's the problem. There it is. Okay. I got caught there. All right. So through this experience, I've learned again and again that mobilizing local government officials to declare support for Medicare for All is an extremely powerful tactic. So why? This is our map, by the way. The resolutions in the pins in green are past resolutions, and the blue ones are places where people are working on resolutions. So why is this so useful? Well, first of all, it's very clear that with about half of freshman Democrats coming into Congress supporting Medicare for All, it's, that's not enough. It should be more than that. It's extremely important to bring politicians into this movement who are before they decide to run for higher office. Secondly, it's not just the progressives on these councils who are willing to work with us. Moderate council members see the costs of our healthcare system on municipal budgets and also have personal reasons to be enthusiastic about Medicare for All. And in our experience, moderates are often easier to approach as champions than one might expect. So let me stop sharing, start share again in a sec. I have a clip coming up of Councilman Stephen Cornell from St. Petersburg testifying on why he decided to introduce a resolution that was presented to him by local activists with Progressive Democrats of America. And I want you to note the tiredness in his voice. See, these activists carried a lot of the work. They put the resolution together and they came up with a set of supporting statistics that he then uses in his own testimony. Right.
And there's a lot of statistics to be thrown around about it that are important, that are accurate, that are important. And so I'll share a little bit of that. 2.6 million people in Florida lacked health insurance at some point for the year 2017. About 13% of our population is uninsured. I think most people can wrap their mind around the idea that waiting until you're sick enough to go to the emergency room is the most expensive way to get health care and the least effective way to get preventive care. All those things, but the point that I really want to stress here is this. When you're a social worker, when you do what I do, you come face to face with it on a regular basis. I think nurses and maybe hospital social workers do more than I do, but I've been face to face with it a lot in my work. And what bothers me is that when I talk to people, there are lots and lots of conversations I've had where people say, oh, no, Steve, you're wrong. Nobody gets turned away for health care. There's a law in place that says you can't be turned away for health care, from health care, even if you don't have insurance. And that's not true. That is absolutely not true, folks. And what I think is part of that is to not believe that. To believe that lets you go on and move on and go about your life because you think everything's okay. But the reality is it's not okay. The reality is kids and families and seniors and all demographics of people are going without. And when you have to face that, I think it compels you to want to do something. So I support this resolution wholeheartedly.
The councilman says that he's actually a social worker. I can't remember if he's still a social worker as he's serving as a council member. And he says, as a social worker, I see so many people who are in advanced stages of disease because they couldn't afford primary care. And he's like really passionate about it. And it's a story, we in our movement, we go around looking for stories all the time, and we don't realize how much our council members are exposed to these stories on a daily basis. So we know that this resolution that was passed in St. Petersburg applied pressure to Representative Kathy Castor, who hasn't signed on to HR 1976, because her office called him. afterwards. I won't say anything about the conversation, but it just goes to show these things do pick up notice. When city governments make this statement, it's a lot harder for members of Congress to say that their constituents do not support this policy. So here is a map, going back to this map, of the resolutions we've passed so far. You can use our website. Again, someone will share the link to the website in the chat to help write your resolution. So for example, I can go down and find one of the Florida ones. June 2019. I can't find it right now, but here's an example. You can go to, you can see a sample resolution, and you can use that to help you write your resolution, add a couple quotes in. In most cases, it's about a page to a page and a half with a few local statistics included. We do have a comprehensive step-by-step toolkit available that a small group of people can use, that someone will also share in the chat. Just giving you a glimpse here, and we will share these links as well after the webinar. In my role at Public Citizen, about 95% of my workload involves supporting activists who are working on resolutions. For many, this is their first experience organizing this kind of a campaign. And as long as there's persistence, they almost always win. I'm available, for one-on-ones, for help with writing op-eds, help with writing press releases, just there to offer general support, helping you to find activists that may live in your area to help out. And we also can help mobilize supporters to call councils ahead of a vote as well in your town. And now we get to the real interactive part. Okay. So we've been hearing all this stuff about why we need Medicare for all. And there are many ways to plug into Medicare for all work in Florida right now. So with my bioregionally appropriate group of animal friends, I'm going to ask you as an activist in Florida who is watching this event and looking to find your place in the movement. So which animal here speaks to you? So please choose your justice fighter and let us know in the chat which of these is you. So if you're looking to join a flock of other activists, the majestic whooping cranes will be gathering on March 9th to plan next steps as part of a statewide strategy. So if that's you, just let us know in the chat. If you are a highly sociable manatee, there's an aggregation on March 10th to call residents of Florida's, I believe it's 8th district, to pressure Representative Darren Soto to sign on to the bill. You don't have to live in this district to participate, but it's a really great way to get to know people really fast who you'll be working with, and also to make a big impact in this movement. So again, that is the Florida Manatee. So let us know if that's you. If you are ready to sing about Medicare for all to your local council, if you want to maybe hang out with me a little bit, join the resolutions organizing call on March 16th, where you'll join a group of activists around the country who are working on resolutions. If this is music to your amphibian ears, please give us a ribbit in the chat. And so I will be sharing this at the end of our program. But again, we're looking at moving forward from this town hall tonight towards action. So here, I'll stop sharing now and bring in our next speaker. Our next speaker is a Unitarian Universalist minister in St. Petersburg. Reverend Bob Murphy is also a board member for the Unitarian Universalists for a Just Economic Community. He is a proud Medicare recipient and works with senior citizens on social justice issues. Welcome, Reverend.
Thank you, Brittany, and thank you all the people who are present tonight. I'm very grateful for this opportunity to speak. As Brittany has mentioned, I am indeed a minister emeritus, senior citizen. I may be one of the oldest people here tonight. I live in an assisted living center in St. Petersburg. And my ministry really involves a lot of mutual aid work, especially with older people, people with disabilities. And right now I'm about 30 feet from a nursing home clinic. So I see many medical problems literally every day, both where I live and in St. Petersburg and different places where I try to provide ministry. As Brittany mentioned, I'm a board member for the Unitarian Universalists for a Just Economic Community. That's a national organization that's been in existence for, at least 30 years and has worked in support of Medicare for all for several decades. We're not unusual among religious organizations because if you go to the Presbyterians, the Methodists, Reformed Jews, Episcopalians, some of the Islamic groups, and certainly other religious groups, you'll find that they too have supported, indicated their support for Medicare for all. Others are certainly very close to an endorsement. And this kind of activity has gone on at least, we're talking about religious organizations, at least for 30 years that I'm aware of. It continues. For the Unitarian Universalists, we gave a formal endorsement for Medicare for all. We were very specific about what we wanted. This was at our 2021 General Assembly last June. And since then, we've been active in trying to reach out in many states to build support for Medicare for all. And again, I emphasize that we're not that unusual. You'll find that there are many religious allies and potential allies throughout Florida and throughout the country. And if you're curious about who might be supportive in your community in Florida, let me know and I'll try to lead you in the right direction. There's really 3 points and then a fourth point that I wanted to emphasize about working with organized religion. First of all, I think it's extremely important when we talk about Medicare for all to make it clear that this is a moral issue and that we have moral concerns that we want to bring forward. We can talk about economics, we can talk about politics, and certainly all these things are important. But for many of us,
being here and telling your
it's a real question that this is right. This is something that is very much needed in order to affirm human worth and human rights. And although different religious groups will use different language and have different traditions, so much of this conversation keeps coming back to a discussion about human rights and human dignity and just affirming these things as moral issues. So please keep that in mind. Second, it's certainly important to bring everybody into the conversation. And when I say everybody, I mean everybody. Young people, old people, immigrant workers, migrant workers, even groups that perhaps aren't usually associated with Medicare for all. Many environmentalists, for example, are becoming interested in universal health care because of their commitment to things like the Green New Deal and their concern for the future of this country for environmental reasons. So you may be surprised at where the potential allies are and try to reach out in as many places as you can. I've bumped into people who assume that older people like myself, because we already have Medicare, we might not be interested in this issue. Believe me, we're very interested in the future of Social Security and Medicare, and we want to see the Medicare program expanded and improved. Certainly for many of us, including myself, the big concern is long-term care. America is aging, and we're concerned about the future of long-term care. We certainly want to encourage independent living as much as we can, but we know that many of the people here tonight will spend their last days in a nursing home or a very similar facility And we want adequate support for long-term care and for everything that's connected. We're also concerned about the high price of drugs. We're concerned about vision, dental, a variety of other things that need to be covered by Medicare. So please include us senior citizens in the Medicare conversation, and especially in Florida. And yes, we vote. we really do. And we want to be included in this conversation. Finally, and several panelists have referred to this already, this is a local issue. It's a grassroots issue. And it will be determined in large part by what happens in local politics. So these resolutions, like we have in St. Petersburg, I do some ministry in Key West, these are very important, and they really send a very powerful message. And get involved at the local level, and especially here in Florida, it's very important. The final message that I want to share with you is, it's been referred to already, but I keep emphasizing it. This COVID pandemic has been a real wake-up call for many people because it's exposed so many problems in the existing medical care system. The American Medical Association, yes, the AMA, not the most progressive group, but the AMA says, you know, the medical care system in this country is a racist system. And we have to confront that reality, and we have to deal with that reality, and we have to solve these problems of systemic racism in medicine. And this is coming from the AMA, which may surprise some of you. There are other problems of economic injustice, discrimination against a variety of vulnerable groups. And these are moral concerns, and they need to be addressed. And I think that the COVID-19 pandemic has certainly moved many Unitarian Universalists to rethink healthcare in this country, to think about ways that congregations can be involved, but to realize that congregations can't do everything. None of the nonprofits can do everything. They can't even come close. GoFundMe is not the solution to medical care problems, friends. We need a social safety net that serves everybody, whether they're religious, non-religious, uncertain, whatever, but we need that basic social safety net. And Medicare for All is enormously important. And I thank all of you for what you're doing to support this good cause. You are very much appreciated. Thank you.
Reverend Murphy, thank you so much for telling us about your experience in organizing with members of the faith community on Medicare for All. Our next speaker, Lorenzo Canizares, is the co-chair of the Labor Community Alliance of South Florida. Lorenzo has an impressive union organizing history and has a lot of knowledge to share with us. Welcome, Lorenzo.
Okay, thank you very much, and I am very pleased to be here with a lot of you that are my friends, and to exchange viewpoints on how we can get this thing moving in the state of Florida. I have a long experience working in trying to get single payer or Medicare for all. Started when I was in Pennsylvania. When I lived in Pennsylvania, I was part of the Pennsylvania group for single payer. And one of the things that we need for a winning campaign, as a union, talking as a union organizer, one of the things that we need for a winning campaign is a theme, and we have the theme. Healthcare is a human right, is something that touches everybody. Everybody is affected by it because nobody can escape that. Nobody can escape the fact of having to deal with healthcare. I am the perfect segue for Reverend Murphy because he opened the door to something that I think is extremely important to point out. And it's the question of how we have dealt with the COVID. And in a recent Nations magazine article, this Abdullah Shihipar, who is a research associate at Brown University, was talking about the concern of a possible collapse of our healthcare system because of COVID, and asked the rhetorical question, how the richest country in the world got into this situation. And he responds that there is a number of reasons, but the primary one is that the United States does not have a free universal healthcare system. The lack of national health insurance affects everything from vaccine hesitancy to the ability to get a test to how we manage the virus. Dr. Alonso previously addressed the fact of how many people he had dealt with that came to him already in a very difficult situation because they didn't take care of their illness because they were afraid of the expenditure. Lynn Ambro, the professor at the University Center of Florida, that preceded us too, talk about how the amount of bankruptcies that have been 66% of the bankruptcies are in the United States are because of healthcare, and that's so. And we also need to understand certain things. Is that like Reverend Murphy mentioned, we have to be open-minded in regards to how approaching other people, and that's one of the advantages of being in labor provides, which is the fact that you have to deal with all kinds of different viewpoints, and you have to get them together into one point to one goal. And so one of the reasons that we need to understand is that a lot of people that have refused to vaccinate, it's not because they are right-wing trolls. It's because they distrust the system. They distrust the healthcare system because what they see, what they have been together with in regards to the healthcare system, it has been a profit-making deal. I originally from Cuba. I am very well aware of what's going on in Cuba. Cuba is a very poor country, but 90% of the people in Cuba have been vaccinated, and there is no campaign to get people to vaccinate. People trust the government, trust the healthcare system. They know the healthcare system is not for profit, so they go unwillingly take the chance. As per Johns Hopkins University, which, by the way, is the guiding light in the whole world in regards to the COVID campaign, the COVID study, the whole overall COVID study. 935,990 people, Americans, have died of COVID-19. And now we are being told to live with the virus. And under that point of view, we are keeping the virus alive by mentally excusing not doing what we know it works. Vaccination works, masks works, testing works, social distancing works. We nationally, but especially here in Florida, have been very timid in doing these things that we know it will work because our main goal has been to make sure that the economy keeps flowing. I don't believe there is no other nation in the world, I might be wrong, but I don't know of any other nation in the world where people have been told that the elderly, people like Reverend Murphy and myself, should sacrifice their lives so the economy is not affected. Not even Bolsonaro in Brazil, who is a monster, has such a thing, as it was said by the Texas Lieutenant Governor Dan Patrick. Our ideological system is a problem. Individualism permeates all our branches of government. I wish Representative Wilson was here so she can corroborate that. It seems that when we try to curb the virus, we get into a whack-a-mole type of situation. When we think it's covered, it pops up somewhere else, like the Supreme Court telling President Biden that he cannot force vaccine mandates. Our vaccines are top of the line. well-recognized, top of the line. The Chinese, with an inferior vaccine, only had 4,636 deaths. This also according to Johns Hopkins. And they have 4 times more people than we do. But they have made COVID the enemy. And they don't have to deal with a GOP that have been pushing a pro-COVID agenda. The GOP have been pushing a pro-COVID agenda. In the December 2021 and the January 2022 issue of the Progressive magazine, there are quotes from a recent report by the Kaiser Health News, which is another wonderful contribution that we do to the whole world healthcare, because they really do good stuff. The Republican lawmakers in at least 26 states are driven by manufacturer outrage over mask mandates, vaccination requirements, and shutdowns, have passed laws to weaken the authority of state and local officials to protect public health. That's genocide. At least 16 states have limited public health officials' power to order mask mandates, quarantines, and isolation. That report from Kaiser Health says. At least 17 states have banned COVID-19 vaccine mandates or passports, or made it easier to get around vaccine requirements. Uninsured people are among those with a lot low. Please pay attention to this, because this is very important. Going again back to what the Reverend Murphy said, which I believe is was a brilliant statement in terms of we need to throw the net wide. Maybe that's because he's a Christian and he understands the concept of the New Testament. Uninsured people are among those with the lowest rate of vaccination, with 56% reporting having received 1 dose in the latest survey conducted by the Kaiser Health News, a lower percentage than Republicans and white evangelicals. Going back to Mr. Shihipar, he mentions a study that pre-pandemic, 22% of Americans, this corroborating what Dr. Alonso said before, delayed healthcare needs because of cost, and that they may be avoiding tests and vaccines for the same reason. And I see that all the time. All the time I see that around me in my working class neighborhood. And what's there for us to do in Florida? And bear with me for a minute, because this is very important. Going back to an experience that we work in Pennsylvania. We have to recognize that the passage of Medicare for all in Florida at this moment is not an immediate. It's not in the immediate ballpark. We need to build a movement that goes out of the box and seeks to work together with others to provide healthcare for our people. We need to unite forces with those people working towards Medicaid expansion, which will cover more than 800,000 Floridians and prevent what is estimated to be 6. This is what Charlie Crist said, and it's been corroborated by many different studies. That is estimated that 6 people die a day because of lack of medical access. And if they had Medicaid, there was Medicaid expansion, that wouldn't happen. As Dr. Alonso I think Dr. Alonso said, or Lynn Unruh said, we have an estimated almost 3 million people in the state of Florida that don't have any medical insurance. None, full stop. What can we do? We need to join. What you guys have done is an incredible job. You have put together a tremendous coalition of people that is powerful. And if we are able to move together, we are going to be able to do all kinds of beautiful things. And we need to join forces in a statewide organization that will recruit members to fight jointly for Medicaid expansion and Medicare for all. Okay, that sounds beautiful. Sounds like, wow, another great idea. Can be done. It can be done. We did it in Pennsylvania. We did it in Pennsylvania with public education. We did it in Pennsylvania because we had an organization behind the campaign that gave the strength and the leadership in order to be able to get the thing done. In 2014, we elected in Pennsylvania. I say we because at the time I was there. We elected Governor Tom Wolf in defeating a Republican incumbent, which is almost unheard of in Pennsylvania. And we defeated him with a campaign around this issue of, and I don't know if everybody can see this. It's a called Partner for Public Education, very simple language, and people will fill out this form, and then they will send the form to me. I was the coordinator of the campaign in Pennsylvania, and the cost of joining the campaign was $1 for 5 years. $1 for 5 years. In 1 year, we got 10,000 members. In an issue that is of great importance. Education is of great importance. Healthcare is even more, because everybody suffers, needs healthcare. Everybody needs healthcare. So we were able to do that. We can do that. We have the theme, healthcare is a human right. And I wanted to also corroborate what I'm saying, because the Secretary of Labor on the Commonwealth of Pennsylvania is Jerry Olekshak, who used to be the president of the Pennsylvania State Education Association, which was the union that I last worked for. We can do this. We can go through a labor union. The National Nurses Union, you couldn't get a better group of people than the National Nurses Union, and SEIU, where we have to work together. We cannot, through a statewide coalition, work towards making healthcare a human right. And we have no time to waste. Let's remember what the research associate from Brown University said. The system, the healthcare system is about to collapse. Thank you very much, and it's been a pleasure. And I'm gonna do the introduction to the next speaker, right?
Yeah.
The next speaker is a dear friend of mine for many years, and a sister in the battle for the well-being of people, no matter where, what, you know, one nationality, whatever. And that's Linda Joseph, who works as a labor organizer for the SEIU. And she is also a small business owner, which in my opinion, she combines in one person the essence of what the middle class is all about. You know, the working person and the just small small business owner. And I leave you with her. And I warn you, it's going to be an upscale from the last speaker. Go ahead, Linda.
I couldn't even try if I wanted to. Lorenzo, thank you for your presentation. Thank you for your passion. Thank you for all you bring to the fight, the labor movement. I want to thank everybody that was on the panel. This was a wonderful, robust conversation. All right, I am Linda Joseph. Like he said, I hail from the great state of Florida. I come with some good news and some really bad news, everybody. I'll start with the good news. The good news that this is winnable. This is winnable, and it's winnable in the state of Florida. If I could begin to tell you the fight that we had to do to get the fight for 15, to get a minimum wage, the fight was relentless. They threw everything at us. They did not believe that people should earn a living. I have the distinct pleasure of organizing marginalized and fast food workers, low wage workers, the people who need us the most. Yes, last year in the pandemic, they got a new title, and the new title was called Essential Workers. They have never seen essential pay. If we're fighting for their basic pay, we know 92% of them don't have health care. So I come to tell you that if we could win Amendment 2, and they made it hard, they kept changing the goalposts and posts, and they kept pushing it back, but people power We came together, people power, and said, no, people should be able to work one job and live and eat. So we're still not there yet. We're on our way. That's why I believe in this campaign. We can win this. If we organize, we stay diligent, we can win this. And our people need us. Here's the bad news, I tell you. All those horror stories are true. We have people who will sacrifice taking their insulin because they just can't afford it. We have a mother who was able to take the day off to take her baby to the hospital. She had to ask a neighbor of a neighbor to take her because she still got to work. And it's still, she didn't have health care. So she had to get up early, 5 o'clock in the morning, to go to the free clinic. So the horror stories are real. We have mothers who have cancer who still work after the chemo because healthcare is so hard to get and it's so scarce, and they have to cut their prescription. So this fight is worth fighting for, and we can win this. And the people who need it need us to continue fighting. So I want to say good night and thank you for all the hard work on everybody on this panel. I thought this was a wonderful and robust panel. Take it on the winning team. We won Amendment 2 last year. We could win Medicaid for all for the whole country. Good night, and thank you, everybody.
Linda, thank you so much for joining us and inspiring us with your words.
The fight is real. We can win this. We can win. People power is so powerful. You know, someone said to me, one of my workers said, Ms. Joseph, that the people are more powerful than the people in power. Take that mantra with you. We can win this.
That's right. And when we talk about Medicare for what Medicare for All means for a state like Florida, it's so important to consider the large proportion of uninsured low-wage workers and the transformative impact that guaranteed healthcare would bring them. I don't remember a single of these national news stories about COVID impacting Florida that talked about this. How many people work in the tourism industry, work in elder care, and are in frontline jobs with no insurance. And then Florida had all these infections. That was not included in this national coverage.
Yes.
I hope that everyone watching tonight is feeling as inspired as I am right now. The response to this Medicare for All town hall has been so overwhelming that it's clear to me that Florida organizers have the skills and the tenacity to set an example for what organizing looks like for the future to the rest of the country. One of my favorite slogans in this movement, it's been mentioned before tonight, is everybody in, nobody out, because that's what Medicare for All means for healthcare. In order to win this legislation, everybody here has to be in. So if you're pumped up as I am, what will be your next step? Here, just sharing it one more time. Are you a crane? Are you a manatee? Or are you the humble but mighty bog frog? Please remember, if you haven't done it already, please put your answers in the chat. We've got the Florida Medicare for All Organizing Committee meeting on Wednesday, March 9th. And they work on a broad range of topics. It's good if you're not sure where you want to get plugged in, but you want to do something, even if it's something little. There's a virtual phone bank party to call voters in an important district and get them to contact their representative to say, we need Medicare for All, so we can get the 8th district to be the 121st co-sponsor of Medicare for All HR 1976. Finally, if you want to hang out with me, Stefan usually comes as well at the Medicare for All resolutions organizing call. We can talk about setting up these campaigns to pass resolutions in your city council and bring that 4th resolution to Florida. So we will be saving the chat log to get back to you. Thank you so much to Representative Wilson and all of tonight's speakers. I know we went a little long. Thank you for bearing with us. We were a little bit utopian in bringing so many amazing speakers tonight and trying to fit them into an hour. So all of you represent what we're trying to build here, a society centered not on profit, but on caring for one another. We will be sharing a video copy of tonight's recording with everyone who registered, along with information for next steps. So thank you and good night.
Thank you.
Thank you.
Good night.